Remember when simple tasks did not cause you pain, when you could garden, cook, or play with your grandchildren without your joints protesting. Today, we will show you how to reclaim those moments of joy, even while living with arthritis. Stay with us to discover practical solutions that thousands of seniors are already using to manage their arthritis pain effectively. Welcome to Health Wellness, where we believe age is just a number. Today, we are discussing a condition that affects nearly 50% of adults over 65 arthritis. Before we begin, if you have not already joined our community of health-conscious seniors, please subscribe to our channel and hit the notification bell. We release new videos focused on helping you live your best life in your golden years. Today's episode will cover everything you need to know about managing arthritis pain naturally, exercises that actually help instead of hurt, and simple modifications to make daily tasks easier on your joints. We understand the challenges that come with arthritis, and we are committed to providing you with practical, evidence-based solutions that you can implement right away to improve your quality of life. Understanding arthritis. Arthritis is not simply a normal part of aging that you must accept. It is a condition that can be managed effectively with the right approach. Many people believe that arthritis is inevitable as we age, but this is not entirely accurate. While the risk does increase with age, there are many factors that contribute to the development and progression of arthritis, many of which you can control. There are over 100 types of arthritis, but the most common among seniors are osteoarthritis, rheumatoid arthritis, and gout. Osteoarthritis develops when the protective cartilage cushioning your joints wears down over time. This form of arthritis typically affects weight-bearing joints like knees, hips, and the spine, but can also affect the hands, particularly the base of the thumb and the joints closest to the fingertips. The cartilage, which normally provides a smooth, gliding surface for joint motion, breaks down and becomes rough. Eventually, if the cartilage wears down completely, bone will rub on bone, causing pain, swelling, and loss of movement. Rheumatoid arthritis is quite different as it is an autoimmune condition where your immune system mistakenly attacks your own joint tissues. Unlike osteoarthritis, which typically affects one side of the body more than the other, rheumatoid arthritis usually affects joints symmetrically. This means if your right hand is affected, your left hand will likely be affected too. This condition can cause the joint lining to become inflamed and swollen, eventually leading to erosion of the joint surface and the underlying bone. Beyond joint symptoms, rheumatoid arthritis can also cause fatigue, fever, and weight loss. Gout is another form of arthritis that many seniors experience. It occurs when uric acid crystals build up in joints, especially the big toe. These sharp, needle-like crystals cause sudden, severe episodes of pain, tenderness, redness, warmth, and swelling. If left untreated, these attacks can become more frequent and damage the joint. Gout is strongly connected to diet, making it one form of arthritis where dietary changes can have a significant impact on symptom management. The symptoms you might experience with arthritis vary depending on the type, but common signs include morning stiffness lasting more than 30 minutes. This stiffness can make it difficult to get out of bed or to move normally after sitting for extended periods. You might also notice pain that worsens with activity, which can discourage you from staying active, creating a cycle that actually worsens your condition over time. Other symptoms include joints that feel warm to the touch, often accompanied by redness and tenderness. This warmth is a sign of inflammation in the joint. You might also experience a reduced range of motion, making it difficult to bend or straighten the joint fully. This limitation can significantly impact your ability to perform daily activities. Swelling around affected joints is another common symptom, sometimes making the joint appear larger than normal. Understanding the specific type of arthritis you have is crucial because treatment approaches can vary. A proper diagnosis from a healthcare provider is the first step toward effective management. This typically involves a physical examination, discussion of your symptoms and medical history, and possibly imaging tests like X-rays or MRIs. Blood tests may also be ordered to check for markers of inflammation or autoimmune conditions. It is important to remember that an arthritis diagnosis is not a sentence to a life of pain and disability. With proper management techniques, most people with arthritis can maintain an active, fulfilling lifestyle. The key is to address the condition holistically, considering not just the physical aspects but also the emotional and lifestyle factors that can impact your experience with arthritis. Natural pain management. Living with arthritis does not mean living with constant pain. There are many effective approaches to manage discomfort naturally, without relying solely on medication. While medications certainly have their place in arthritis treatment, incorporating natural pain management strategies can significantly improve your quality of life and possibly reduce your need for pharmaceutical interventions. Heat and cold therapy are among the simplest yet most effective tools for managing arthritis pain. Applying a heating pad for 20 minutes can provide significant relief from stiffness, especially in the morning when many people with arthritis experience the most difficulty moving. The heat works by improving blood circulation to the affected area, which helps relax tense muscles and reduce joint stiffness. You can use electric heating pads, microwavable heat packs, or even a warm shower or bath to achieve this effect. Cold therapy works in a different but equally beneficial way. Using cold packs wrapped in a thin towel for 10 to 15 minutes can reduce inflammation and swelling after activity. The cold narrows blood vessels, decreasing blood flow to the area and reducing swelling and inflammation. It also has a numbing effect that can temporarily dull pain signals. For best results, use a commercial ice pack or even a bag of frozen vegetables, but always wrap it in a towel to protect your skin from direct contact with the ice. Many people find that alternating between heat and cold provides optimal relief. You might start your day with heat to loosen stiff joints, use cold after activities that may cause flare-ups, and end your day with heat again to promote relaxation and better sleep. The key is to pay attention to how your body responds and adjust accordingly. Diet plays a crucial role in managing arthritis inflammation and pain. Anti-inflammatory foods can help reduce the body's inflammatory response, potentially decreasing arthritis symptoms. Fatty fish like salmon, mackerel, sardines, and trout are rich in omega-3 fatty acids, which have been shown to reduce inflammation in the body. Aim to include these fish in your diet at least twice a week. If you are not a fan of fish oil supplements can be an alternative, though it is always best to consult with your healthcare provider before starting any supplement regimen. Colorful fruits and vegetables are packed with antioxidants and phytochemicals that fight inflammation and protect your cells from damage. Berries are particularly beneficial due to their high anthocyanin content, a compound that has anti-inflammatory effects. Dark leafy greens like spinach, kale, and collard greens contain compounds that can help suppress inflammatory cytokines, molecules that promote inflammation in the body. Nuts and seeds, especially walnuts and flax seeds, are excellent sources of alpha-linolenic acid, ALA, a type of omega-3 fatty acid. They also contain various antioxidants that can help reduce inflammation and oxidative stress. A small handful of nuts daily can be a nutritious addition to an anti-inflammatory diet. Olive oil should be your primary cooking oil as it contains oleocanthal, a compound with similar anti-inflammatory properties to NSAIDs like ibuprofen. Extra virgin olive oil has the highest levels of beneficial compounds, so look for this variety when shopping. Spices like turmeric and ginger have been used for centuries in traditional medicine to treat various ailments, including inflammation. Curcumin, the active compound in turmeric, has powerful anti-inflammatory effects. Similarly, gingerol in ginger has been shown to have anti-inflammatory and antioxidant properties. Incorporate these spices into your cooking or enjoy them as tea for added benefits. While it is important to include anti-inflammatory foods in your diet, it is equally important to reduce consumption of foods that may trigger inflammation. Processed foods and refined sugars can promote inflammation in the body and exacerbate arthritis symptoms. These include packaged snacks, white bread, pastries, and sugary beverages. Excessive red meat, especially processed meats like sausages and hot dogs, has been linked to increased inflammation. If you enjoy red meat, opt for lean cuts and limit consumption to once or twice a week. Foods high in saturated fats, such as full-fat dairy products and fatty cuts of meat, can also contribute to inflammation and should be consumed in moderation. Gentle movement is essential for arthritis management, contrary to what many people believe. When you have arthritis, you might feel inclined to avoid movement to prevent pain. However, appropriate physical activity is actually one of the best ways to manage arthritis symptoms. Regular exercise helps strengthen the muscles around your joints, maintains bone strength, improves your energy levels and mood, helps with weight management, and promotes better sleep. All of these benefits contribute to better arthritis management and overall health. The key is to engage in the right types of exercise that will benefit your joints without causing additional stress or pain. Low-impact activities are generally best for people with arthritis. These include walking, cycling, swimming, and water aerobics. Water exercises are particularly beneficial because the buoyancy of water supports your body weight, reducing stress on your joints while providing resistance for muscle strengthening. In addition to these physical strategies, managing stress is an important aspect of natural pain management for arthritis. Chronic stress can increase inflammation in the body and lower your pain threshold, making arthritis symptoms feel worse. Techniques such as deep breathing, meditation, progressive muscle relaxation, and guided imagery can help reduce stress levels and potentially decrease pain perception. These practices can be particularly helpful when incorporated into your daily routine, especially before bed, to promote better sleep. Sleep quality itself has a significant impact on pain perception and arthritis management. Poor sleep can increase pain sensitivity and exacerbate inflammation, creating a cycle where pain disrupts sleep and poor sleep worsens pain. Creating a comfortable sleep environment, establishing a regular sleep schedule, limiting screen time before bed, and using heat therapy before sleep can all contribute to better rest. Massage therapy can also provide relief for arthritis pain. Gentle massage around affected joints can improve circulation, reduce tension, and temporarily relieve pain. You can visit a professional massage therapist experienced in working with arthritis patients, or learn simple self-massage techniques to use at home. Using warm oil or applying heat before massage can enhance its benefits. Acupuncture is another alternative therapy that some people with arthritis find beneficial. This traditional Chinese medicine practice involves inserting thin needles into specific points on the body to relieve pain and promote healing. While research results are mixed, many individuals report significant pain relief from regular acupuncture sessions. Topical treatments can provide localized relief for arthritis pain. These include over-the-counter creams, gels, and patches containing ingredients like capsaicin, derived from chili peppers, menthol, or salicylates. These products work by either blocking pain signals, reducing inflammation, or creating sensations of heat or cold that distract from pain. They can be particularly helpful for joints close to the skin surface, like those in the hands and knees. Natural pain management for arthritis is most effective when multiple strategies are combined and tailored to your specific needs. What works well for one person might not work as well for another, so it is important to experiment with different approaches under the guidance of your healthcare provider. Keep a journal to track which strategies provide the most relief for your particular symptoms and circumstances. Arthritis-friendly exercises. Exercise is one of the most effective non-drug treatments for arthritis. Regular physical activity helps maintain joint function, strengthen the muscles around your joints, improve your balance and coordination, and enhance your overall quality of life. However, not all exercises are created equal when it comes to arthritis. The key is to choose activities that provide the benefits of movement without putting excessive stress on your joints. Range of motion exercises are fundamental for maintaining and improving joint flexibility. These exercises move your joints through their full range of motion and help reduce stiffness. Finger curls are an excellent example of a range of motion exercise for hand arthritis. To perform finger curls, start with your hand open and fingers straight, then slowly close your hand, making a gentle fist. Hold this position for a few seconds, then slowly open your hand again, spreading your fingers wide. Repeat this movement 10 times for each hand. This exercise helps maintain flexibility in your finger joints and can improve your ability to grasp objects in daily activities. Shoulder rolls are beneficial for maintaining shoulder mobility, which is essential for many daily tasks such as dressing, reaching for objects, and personal care. To perform shoulder rolls, sit or stand with your back straight and let your arms hang relaxed at your sides. Slowly roll your shoulders forward in a circular motion 5 times. Then reverse the direction and roll them backward 5 times. This gentle movement helps lubricate the shoulder joints and maintain their range of motion. Neck tilts can help relieve tension and stiffness in the neck, which is common in people with cervical spine arthritis. Sit or stand with your spine straight and slowly tilt your head toward your right shoulder, feeling a gentle stretch along the left side of your neck. Hold this position for 5 seconds, then return to the center and repeat on the left side. Perform this movement 5 times on each side. Remember to move slowly and never force your neck beyond a comfortable range of motion. Strengthening exercises are equally important for arthritis management. Strong muscles provide better support for your joints, reducing the stress placed on them during daily activities. Chair stands are an excellent lower body strengthening exercise that also improves functional ability. Sit in a sturdy chair with your feet flat on the floor, hip-width apart. Lean slightly forward at the hips and slowly stand up, using the armrests for support if needed. Once standing, pause briefly, then slowly lower yourself back to a seated position. Repeat this movement 5 to 10 times, gradually increasing the number of repetitions as your strength improves. This exercise strengthens the muscles in your thighs and buttocks, which are essential for walking, climbing stairs, and rising from seated positions. Wall push-ups are a modified version of traditional push-ups that put less stress on your joints while still strengthening your chest, shoulders, and arms. Stand facing a wall at arm's length. Place your hands on the wall at shoulder height and shoulder width apart. Keep your feet flat on the floor and slowly bend your elbows, bringing your chest toward the wall. Push back to the starting position. Repeat 10 times. As your strength improves, you can increase the number of repetitions or step further away from the wall to increase the intensity. Leg lifts are effective for strengthening the muscles that support your hip and knee joints. Sit in a sturdy chair with your back straight and feet flat on the floor. Slowly extend one leg straight out in front of you, keeping your thigh on the chair. Hold this position for 3 seconds, then slowly lower your foot back to the floor. Repeat 10 times with each leg. This exercise strengthens the quadriceps muscles at the front of your thighs, which are crucial for knee stability and function. Aquatic exercises are particularly beneficial for people with arthritis because water provides both support and resistance. The buoyancy of water reduces the impact on your joints while its resistance helps strengthen your muscles. Water walking is a simple yet effective aquatic exercise. Walk forward, backward, and sideways in chest-deep water, maintaining good posture and using your arms for balance and additional movement. This exercise improves cardiovascular fitness, strengthens multiple muscle groups, and enhances balance and coordination with minimal joint stress. Gentle leg kicks while holding the pool edge can strengthen your lower body without straining your joints. Hold onto the pool edge with both hands, extend your legs behind you so they float near the surface, and gently kick them up and down in a flutter motion. Start with 30 seconds of kicking and gradually increase the duration as your endurance improves. This exercise targets the muscles in your legs and core while the water supports your body weight. Arm circles in chest-deep water provide an excellent workout for your shoulder joints and the muscles that support them. Stand in chest-deep water with your arms extended out to the sides at shoulder height. Make small circles with your arms, gradually increasing the size of the circles as comfort allows. Perform 10 circles forward, then 10 circles backward. The water's resistance makes this a more effective strengthening exercise than performing the same movement on land, while the buoyancy supports your arms and reduces strain on your shoulders. When engaging in any exercise with arthritis, it is crucial to listen to your body and distinguish between normal discomfort and harmful pain. Some muscle soreness, especially when beginning a new exercise routine, is normal and typically subsides within a day or 2. However, sharp pain during an exercise or pain that increases or persists long after your workout is a warning sign that you should stop that particular activity and possibly consult with your healthcare provider. Proper warm-up before exercise is essential for people with arthritis. A 5 to 10 minute warm-up of gentle movements similar to your planned activity but at a lower intensity helps increase blood flow to your muscles and lubricate your joints, preparing them for more vigorous activity and reducing the risk of injury. Similarly, a cool-down period after exercise allows your heart rate and breathing to return to normal gradually and may help reduce post-exercise stiffness. Consistency is key when it comes to exercise for arthritis management. Regular, moderate activity is more beneficial and less likely to cause injury than sporadic, intense workouts. Aim for at least 150 minutes of moderate exercise per week, spread across multiple days. Remember that any movement is better than no movement, so even on days when your arthritis symptoms are more pronounced, gentle stretching or a short walk can be beneficial. It is also important to modify exercises as needed to accommodate your specific condition and symptoms. Using adaptive equipment such as resistance bands instead of weights, exercising on softer surfaces, or reducing the range of motion for certain movements can make exercise more comfortable and sustainable. Working with a physical therapist who specializes in arthritis can be invaluable in developing a personalized exercise program that addresses your specific needs and limitations. Exercise not only helps manage the physical symptoms of arthritis, but also provides significant mental health benefits. Physical activity stimulates the release of endorphins, natural mood elevators that can help combat the depression and anxiety that sometimes accompany chronic conditions like arthritis. Regular exercise can also improve sleep quality, increase energy levels, and enhance overall well-being, making it an essential component of comprehensive arthritis management. Making daily tasks easier. Living with arthritis often means that everyday activities can become challenging and painful. However, with some thoughtful modifications and the right tools, you can continue to perform daily tasks independently and with greater comfort. The goal is not just to manage pain, but to maintain your independence and quality of life despite joint limitations. Kitchen activities are often particularly challenging for people with arthritis due to the gripping, twisting, and precision required for many cooking tasks. Using utensils with cushioned, wider handles can make a significant difference in your comfort and ability to prepare meals. These adaptive utensils distribute pressure more evenly across your hand and require less grip strength to use effectively. Many companies now make ergonomic kitchen tools specifically designed for people with arthritis and other hand limitations. Opening cans and jars can be one of the most difficult kitchen tasks for those with hand and wrist arthritis. Electric can and jar openers eliminate the need for painful twisting and gripping motions. While these devices might seem like a luxury, they can be essential tools for maintaining independence in the kitchen. For those who prefer not to use electric openers, or for situations where they are not available, rubber jar grippers or jar opening levers can also make this task easier. When working in the kitchen, sliding heavy items along countertops rather than lifting them can protect your joints from unnecessary strain. This simple habit change can significantly reduce the risk of pain flare-ups after cooking. Planning your kitchen layout so that frequently used items are stored at easily accessible heights can also minimize reaching and bending, which can be painful for those with spine, shoulder, or hip arthritis. Using lightweight cookware with two handles allows you to distribute the weight between both hands, reducing strain on any single joint. Cast iron pans may be traditional, but aluminum or ceramic cookware might be more practical choices for those with arthritis. Look for pots and pans with helper handles opposite the main handle to make lifting and carrying easier and safer. Meal preparation techniques can also be modified to accommodate arthritis limitations. Using a food processor for chopping, slicing, and grating can reduce the repetitive hand motions that often aggravate hand and wrist arthritis. Cooking larger batches and freezing portions for later use can reduce the frequency of cooking when symptoms are particularly bothersome. Electric mixers, slow cookers, and pressure cookers can also reduce the physical demands of cooking while still allowing you to prepare nutritious and delicious meals. Dressing can be another challenging daily activity for those with arthritis, particularly when it involves manipulating small buttons, zippers, or shoelaces. Button hooks and zipper pulls are simple devices that can make these tasks much easier. A button hook has a wire loop at the end of a handle that can be pushed through a buttonhole, hooked around the button, and pulled back through, eliminating the need for precise finger dexterity. Zipper pulls attach to regular zippers to extend the pull tab, making it easier to grasp and operate. Long-handled shoe horns allow you to slip into shoes without bending over or straining your fingers to pull the back of the shoe. This can be particularly helpful for those with hip, knee, or lower back arthritis who find bending difficult. The extended length provides the leverage needed to ease your foot into the shoe while maintaining a comfortable upright position. Elastic shoelaces that do not require tying are another simple but effective solution for making footwear more accessible. These special laces turn lace-up shoes into slip-ons while maintaining the appearance of traditional laces. Alternatively, shoes with Velcro closures or slip-on styles can eliminate lacing altogether, making them excellent choices for those with hand arthritis. Consider your clothing choices as well. Garments with front closures are generally easier to manage than those that fasten in the back. Clothes with elastic waistbands, larger buttons, magnetic closures, or Velcro fasteners can be easier to manage than those with small buttons or hooks. Loose-fitting clothes are not only easier to put on and take off but also put less pressure on painful joints throughout the day. Bathroom activities present their own set of challenges, often involving wet, slippery surfaces and awkward positions that can strain joints and pose fall risks. Grab bars in bathrooms provide stability and support when getting in and out of the tub or shower or when using the toilet. These should be professionally installed to ensure they can support your weight if needed. Strategic placement of grab bars can make a significant difference in bathroom safety and independence. Raised toilet seats reduce the distance you need to lower and raise yourself, making it easier on your knees and hips. Some models come with attached armrests for additional support and stability. This simple modification can make a substantial difference in comfort and safety for those with lower body arthritis. For bathing, a shower chair or bath bench allows you to sit while showering, reducing fatigue and the risk of falls. Long-handled sponges or washcloths on handles can help you reach your back and feet without uncomfortable stretching or bending. Handheld shower heads offer more flexibility in directing water flow, allowing you to remain seated while effectively rinsing all areas. Throughout your home, reaching tools, sometimes called grabbers or reachers, can be invaluable for retrieving items from high shelves or the floor without stretching or bending. These tools typically have a trigger handle that controls pincers at the opposite end, allowing you to grasp objects at a distance. This reduces the need for movements that might exacerbate arthritis pain in the shoulders, back, or knees. Organizing your living space with arthritis in mind can significantly improve your daily experience. Keep frequently used items within easy reach, between waist and shoulder height. Replace round doorknobs with lever handles, which require less grip strength and wrist rotation to operate. Consider furniture height carefully. Chairs and sofas that are too low can be difficult to rise from if you have knee or hip arthritis. The key principle to remember is that using adaptive tools and modifying tasks is not a sign of weakness or giving up. It is a smart approach to energy conservation and joint protection that can help you maintain your independence and continue participating in activities you enjoy. The goal is not to struggle through pain, but to find better ways to accomplish what you need and want to do. Technology has also created many solutions for those living with arthritis. Voice-activated assistants like Amazon Alexa or Google Home can help you control lights, thermostats, and other home features without having to manipulate small switches or buttons. Automatic jar openers, electric can openers, and other kitchen gadgets can make meal preparation easier. There are even apps designed specifically for people with arthritis that can help track symptoms, remind you to take medications, or guide you through appropriate exercises. When considering which modifications to implement, start with the activities that cause you the most difficulty or pain. Make changes gradually, focusing on solutions that address your specific challenges. Remember that what works well for someone else with arthritis might not be the best solution for you, as arthritis affects each person differently. Be willing to experiment with different tools and approaches until you find what works best for your particular situation. When to seek medical help. While self-management strategies are essential components of arthritis care, knowing when to consult healthcare professionals is equally important. Partnership with medical providers ensures that you receive appropriate diagnosis, treatment, and monitoring to prevent unnecessary joint damage and maintain your quality of life. Understanding when to seek medical help empowers you to be proactive about your health without becoming overly anxious about normal fluctuations in symptoms. You should schedule an appointment with your doctor if you experience new, unexplained joint pain lasting more than 3 days. While occasional brief joint discomfort can be normal, persistent pain may indicate a new problem or a change in your condition that requires medical evaluation. Early intervention can often prevent more serious complications and joint damage. Significant swelling, redness, or warmth around a joint warrants prompt medical attention, especially if these symptoms appear suddenly. These signs of inflammation could indicate an infection or a flare-up of inflammatory arthritis that may require specific treatment. Joint infections, although rare, are serious conditions that require immediate medical care to prevent permanent damage to the joint. Episodes of intense pain, even if they come and go, should not be ignored. Intermittent severe pain might indicate conditions like gout or pseudogout, which involve crystal formation in the joints and require specific treatments. These conditions can cause permanent joint damage if left untreated, even during periods when you are not experiencing symptoms. Morning stiffness lasting more than an hour is a characteristic symptom of inflammatory types of arthritis, such as rheumatoid arthritis. If you notice that your stiffness is becoming more prolonged or severe, it may indicate that your current treatment plan needs adjustment. This is particularly important for inflammatory arthritis, where proper disease management can slow or prevent joint destruction. Difficulty performing basic activities of daily living, such as dressing, bathing, or preparing simple meals, indicates that your arthritis is significantly impacting your function and quality of life. This level of impairment suggests that your current management approach is not sufficient and that additional interventions may be needed. Healthcare providers can help you access appropriate resources, which might include physical or occupational therapy, assistive devices, or medication adjustments. When visiting your healthcare provider, come prepared to discuss your symptoms in detail. Keep a journal of your pain levels, stiffness, and any factors that seem to worsen or improve your symptoms. Note any changes in your ability to perform daily activities. This information helps your doctor understand your condition and determine the most appropriate treatment approach. Treatment options your doctor might discuss include physical therapy tailored to your specific needs. Physical therapists are movement experts who can design individualized exercise programs to improve strength, flexibility, and function while minimizing joint stress. They can also teach you proper body mechanics and joint protection techniques to use during daily activities. Some physical therapists specialize in arthritis management and can be valuable partners in your care. Prescription medications for pain and inflammation may be recommended, depending on the type and severity of your arthritis. For osteoarthritis, these might include higher strength versions of over-the-counter pain relievers or topical medications. For inflammatory types of arthritis, disease-modifying anti-rheumatic drugs, DMARDs, might be prescribed to slow the disease progression and prevent joint damage. Biologic response modifiers are newer, targeted medications that can be very effective for certain types of inflammatory arthritis. Your doctor will consider your specific diagnosis, overall health, and other medications you take when recommending a medication regimen. Injections for targeted relief are another option your doctor might suggest. Corticosteroid injections can provide temporary but significant relief from inflammation and pain in specific joints. Hyaluronic acid injections, sometimes called viscosupplementation, may be recommended for knee osteoarthritis to supplement the natural joint fluid. Platelet-rich plasma, PRP, injections are a newer approach that uses components of your own blood to potentially promote healing and reduce inflammation, although research on their effectiveness is still evolving. Surgical options for severe cases might be discussed if your arthritis causes significant pain and disability despite other treatments. These range from arthroscopy, a minimally invasive procedure to remove damaged tissue, to partial or total joint replacement. Joint fusion is sometimes recommended for certain joints, particularly in the hands, wrists, ankles, and spine, when replacement is not appropriate. The decision to pursue surgery is a significant one that should be made after careful consideration of the potential benefits, risks, and alternatives in consultation with your healthcare providers. Regular follow-up care is important even when your symptoms are well controlled. Periodic visits allow your healthcare provider to monitor for any changes in your condition or potential side effects from medications. They also provide opportunities to discuss any new treatment options that might become available as medical science advances. Remember that arthritis care often requires a team approach. Depending on your needs, your healthcare team might include not only your primary care physician but also rheumatologists, specialists in joint diseases, orthopedic surgeons, physical and occupational therapists, pain management specialists, and mental health professionals to help with the emotional aspects of living with a chronic condition. Do not hesitate to ask for referrals to specialists if you feel your needs are not being fully addressed. It is also important to discuss complementary and alternative treatments with your healthcare provider before trying them. While many alternative approaches, such as acupuncture, massage, or supplements, can be beneficial when used appropriately, they can sometimes interact with conventional treatments or might not be suitable for your specific condition. Your doctor can help you evaluate these options and integrate them safely into your overall treatment plan. Being an active participant in your healthcare decisions is crucial for effective arthritis management. Ask questions about recommended treatments, including potential benefits, risks, and alternatives. Discuss your treatment goals, whether they focus on pain relief, maintaining function, preventing joint damage, or a combination of these objectives. Your input is essential in developing a treatment plan that aligns with your values and priorities. Conclusion: arthritis does not have to define your golden years. With the strategies we have discussed today, appropriate exercise, dietary adjustments, helpful tools, and medical guidance when needed, you can maintain your independence and continue enjoying life's precious moments. Managing arthritis successfully requires a comprehensive approach that addresses both the physical and emotional aspects of living with a chronic condition. Remember, small changes applied consistently make the biggest difference. Start with just one recommendation from today's video and build from there. Perhaps begin with a simple range of motion exercise routine each morning, or experiment with heat therapy before bed. As these practices become habitual, gradually incorporate additional strategies. This step-by-step approach prevents overwhelm and allows you to identify which techniques work best for your particular situation. Patience is essential when implementing new arthritis management strategies. Some approaches, particularly exercise and dietary changes, may take weeks or even months to show their full benefits. During this time, you might experience some discomfort as your body adjusts to new movements or as you build strength. This is normal and typically subsides as you continue with your program. However, remember that sharp pain or significant increases in symptoms are signs to modify your approach or consult with a healthcare professional. Maintaining a positive outlook, while acknowledging the challenges of arthritis, can significantly impact your experience with the condition. Research has shown that psychological factors, including attitude and expectations, can influence pain perception and functional outcomes. This does not mean that arthritis pain is all in your head. The pain is very real, but your mental approach can affect how you experience and respond to that pain. Social connection is another important aspect of living well with arthritis. Sharing experiences with others who understand your challenges can provide emotional support and practical tips. Consider joining an arthritis support group, either in person or online. The Arthritis Foundation and similar organizations offer resources for connecting with others who are navigating similar journeys. Remember that arthritis management is not static. It evolves over time as your condition changes, as you age, and as new treatment options become available. Regular reassessment of your management strategies, in consultation with your healthcare providers, ensures that your approach remains effective and appropriate for your current situation. If you found this information helpful, please support our channel by liking this video, subscribing if you have not already, and sharing with friends or family members who might benefit. Your engagement helps us reach more people with information that can improve their quality of life. Join us on next video when we will be discussing heart-healthy habits for seniors. Until then, keep moving, stay positive, and be kind to your joints. Remember that you are not alone in your journey with arthritis, and with the right approaches, you can continue to live a full and active life despite the challenges this condition presents.